and I know people have a lot of questions and a lot of frustrations, but I think it's some visions of what we could do differently. So go ahead and introduce yourselves, and we're going to go ahead and get started. I am New York City Council member Brad Lander, and it's a really an honor to get to talk to you. And I guess I want to ground us by reflecting on the fact that on the one hand, everybody knows that there is nothing more important than getting our schools open safely and supportively for all of our kids so they can be resilient together and grow together and thrive together. And there's a lot of challenges in doing that. But what we want to do is meet them together, is like rise in solidarity between students and families and educators and teachers and principals and school staff and crossing guards and cafeteria workers. And the ways in which that has gotten hard, and especially on Twitter, but not only on Twitter, so fraught with anger, is really understandable, because the inequalities in the city and the society, the way we don't show up for people's public health, the way we don't support our educators, the way we haven't made our schools safe for all our kids, of course, they sit underneath all of these challenges. And the pandemic has fractured us and put us sort of at each other rather than with each other. And what we want to do tonight is try to make some room for really good, honest conversation about how we get back to where we want to be. And I say that in the roles I'm sitting in. I'll just reflect. A few people chimed in, even though we've got this amazing panel, and said, where's the public school parent on the panel? Where's the school guidance counselor on the panel? So one thing I will say is I am a public school parent of a New York City public school student who's had 4 days of school this year. And I'm the son of a public elementary school guidance counselor, lifelong, who's still in retirement back in public schools, teaching kids mindfulness meditation to navigate their way through this pandemic. So I feel you. We've got an amazing panel. We're going to try to get to as many questions as we can too, to have really good, productive conversation. I know a lot of you are probably coming from the petition that we did about ending the 2-case rule so our schools could be more open again for our kids. And I know a lot of you are coming from real passion to say, I want to make sure it's safe in our schools. And the challenge we set ourselves tonight was a set of panelists who could talk about what it will look like to get our schools open safely, supportively, and more justly, with real honesty about how hard that will be and how important it is. So we put an amazing panel together, and I'm really excited for them to introduce themselves to you. We told you their bios as you signed up for the event, so I'm not going to read them to you, but I asked them each just to start by introducing themselves, who they are and kind of what their connection to public education is. But then especially, just for starters, that one thing, here's one thing I want to make sure is different. I want us to make sure is different on the other side of this pandemic and that we learn from it. So we'll go in the order, Celine, Shael, José, Emma. Thank you guys so much for being here. I know you've each been on like 1,000 Zooms. You've got 1 million demands on your time. You each have, busy lives yourselves. It's another evening. So really grateful that you are here to share and think together with us. Go ahead, Celine.
Sure, and it's really great to be here, and I really appreciate the opportunity to be of service to the community here. So I'm an infectious disease specialist, an epidemiologist. I am with the NYU Grossman School of Medicine, and I see patients at Bellevue Hospital. I'm not going to rattle off all the different things I have done over time, but I most recently served on the Biden-Harris Transition COVID Advisory Board. I also was the Assistant Commissioner of Health here in New York City and have worked in a number of places, both in the US, urban, rural, as well as overseas. And so have just, seen a lot of different ways things are done. In terms of your question about what do I want to see on the other side of all of this, I am really hoping for a much more equitable approach to public education. I think it's highly problematic that public education is funded in large part through property taxes, because when you have residential segregation, de facto segregation in much of the country, it means you are going to have inequity in funding for the schools. And I think that's highly problematic. And I would really like to see a change in the funding formula. And also more concretely, a real change in the way we maintain public school buildings, the resources we have available to students in public schools, and the resources we have for staff at public schools.
Amen. All right, Shael's the panelist I've known the longest. We go back to our 20s. So Shael, thank you for being here.
Hi, everyone. It's good to be here this evening. I'm Shael Polakow-Suransky, and I am president at Bank Street College of Education. I also worked for many years in the Department of Ed. I started as a teacher in the early 90s and was a high school principal. And I ultimately, my last job there was as deputy chancellor. And as I think about what we're learning at this moment in time and how we begin to think about the future, I think we have to recognize that both our children and the educators in our schools are developing human beings, and they need to be understood and supported in their development, both academically and socially and emotionally. And that sounds simple, and yet it is not at all how our school system is organized. In fact, it's almost as if we've deliberately organized it in reverse of that goal. So as we come back, we have a clear challenge to re-engage both children and families in schools. And it's important we recognize the trauma so many of us have experienced over this past year, but we also need to stop talking about learning loss and stop framing children as coming from a deficit or a damaged place. Let's begin with children's strengths and work to deeply understand their next steps and build from there.
Hello, everyone. My name is José Vilson. Before this year, I was a 15-year math teacher in Washington Heights. Shout out to Washington Heights, shout out to District 6. And I was also a National Board Certified Teacher, Math for America, so on and so forth. Also the Executive Director of Educolor, an organization dedicated to race and social justice issues, as well as a parent, a public school parent in District 3. Shout outs to the Elaine Locke School of an 8-year-old, now 9-year-old. So needless to say, I come with many hats into this conversation. One of the things that I would love to hear more about from any number of policymakers is how we're going to continue the virtual blending model to assure that students who aren't normally adherent to school norms are still able to acclimate to any number of objectives and learning standards. I think we have some potential in the ways of allowing for students to feel like they can still keep up with the learning even as any number of things or situations happen. And I'm including folks, for example, who are our students with interrupted formal education, our students who are consistently moving across different states, our students who are consistently at the lower, I guess, rungs of disciplinary measures. So in the ways that we can adhere and maybe adjust the ways that we do schooling for so many of our kids would be really important as we try to open up school buildings, because as far as I'm concerned, school has been open for a while, but the building, on the other hand, is a whole nother matter.
Hi, my name is Emma Rehac. My pronouns are her, she. I am 19 years old, so I was a public school student all my life. I just graduated from New York City's public schools on Zoom. I'm now a first-year college student living in Harlem. I think one thing that I would love to see as kind of a result of this pandemic, something that changes in our education system, is kind of a transfer of power to more decision-making and autonomy for students, parents, educators, recognizing that people who are going to schools and work in schools are the people who know what's best for schools. And so I think that so many of the issues that have been exacerbated and that we've seen through this pandemic would have been prevented if, students, parents, and educators were the ones who were in charge of making decisions over their own communities.
I'm also going to note that Emma was the MC this weekend for an amazing rally of the Coalition for Racially Just Public Schools and the Coalition for Asian Children and Families, bringing people together around anti-Asian hate, but with people that were out there marching for Black lives and are demanding racially just public schools. And there was amazing band and culture, and it was really one of the most powerful of the events. So, all right, that was a great way to start. And I actually feel like grounded in that vision you guys just described of where we could get to can hopefully help us work through like a lot of the really hard challenges of the months to come. What we're gonna do now is I'm just gonna ask one question each of the panelists. And then after that, we're gonna throw it open, take the questions you guys have put in the chat, try to get to as many of the things you guys are already raising there as we can in the time we have. We really wanna make sure that we're starting though, like grounding ourselves in the public health data and what the science teaches us. So Dr. Gounder, can you give us some grounding on what the public health data is saying right now about what's going on in our schools, what's safe, how we can make it safe? And that's both now in the spring and as we start to think about the summer and the fall as well.
Yeah, and even before answering that, Brad, I just want to preface my comments by saying, as I mentioned, I've worked in many different settings over time in sub-Saharan Africa, on Indian reservations, in both urban and rural settings. And what I've seen over and over again is you often have this disconnect between public health officials, clinicians, and community, and it could be any, all sorts of different communities. Here we're talking about the communities in schools, so educators, their staff, students, and their families. But what I've seen over and over again is there's not enough listening. And so I really do hope that you all will send in your questions and comments, because I really would love to hear your perspective on some of these things. And one question in particular I'd like to throw out there is what would make you as parents and students feel safer about returning to the classroom? I think there's been a lot of focus on how do we make teachers feel safe, and I think that's absolutely important. I have two sisters who work in education. One is a high school principal in Houston, where I think they've been hit very hard. My entire husband's side of the family, except for him, are all educators. So I understand that perspective. So I really do want to hear what would be necessary for parents to feel safer about sending their kids back to school. So in terms of what does the science say, we've learned a lot about the pandemic over the past year. It's really been a crash course in the virus. And so in the beginning, I think we went from downplaying and underreacting to then very quickly having to institute very strict lockdown measures as we saw how cases were rising, especially in places like here in New York. And then we were really trying to be as cautious as possible until we knew more, until we studied more. And even as of last summer, and I remember speaking with Brad, some of the other New York City councilmen, the public advocate, and others about this, even as of last summer, we were starting to get data that did show that there was a big difference with respect to younger children versus older children in terms of how likely they are to get infected and transmit onwards to adults. And that data has really solidified over the past year, where there does seem to be a much lower risk of transmission from younger children versus the teenagers with respect to how likely they are to transmit onward to adults. So I think that's one piece I think is really important here. Another thing that we have learned over the past year is that when you do institute masking and appropriate ventilation, and I know here in New York, the Department of Education and the Department of Health work together to figure out how to ventilate classrooms. In some places, it was as simple as opening windows. In other places, that's not an option. And they had to place HEPA air filtration units to make sure they had adequate ventilation. But with those measures in place, with testing and contact tracing in place, they really were able to make it safe for in-person learning. And I think, again, it's really important to understand that children are not adults when it comes to medicine and in terms of risk. And again, we have learned that children, especially younger children, are far less likely to be spreading infection to adults. So when you do the testing in schools, the screening, we are finding much lower rates of coronavirus in the schools among the students in schools than we are in the broader community. And so that's a combination of the kids are lower risk, and they're actually much more likely to be abiding by the public health mitigation measures of wearing masks and being in a well-ventilated space than if they're out in the community. And some of what we've seen is in places where there have been school shutdowns, at least to in-person learning, where you've had kids playing, play dates and so on, not masked, not following these guidelines, then you do see some spread. We saw this at a camp in Georgia last summer. And so you really have to separate by the age group. You have to separate by the setting and what measures are in place in that setting. But when you have the masking and the ventilation, that really makes a huge difference. Now, and testing, I should say, as well. Now, you probably have heard about the new CDC guidelines about 3 foot versus 6 foot. And where does that 6 foot come from? I think is a good place to start. So that 6 foot rule really comes from the assumption that SARS-CoV-2 COVID was spread through droplets. So there are different kinds of respiratory diseases. You have droplet-borne spread, which is sort of those juicy fat droplets that spray out of your mouth or your nose when you sneeze or you cough. Those are visible. And because they're bigger and heavier, they drop down to the ground more quickly. And so within a 6 foot radius, you see those droplets fall to the ground. Aerosols are different. Aerosols are much smaller, and those float through the air and can travel much longer distances. And what we have learned is that SARS-CoV-2 is transmitted through aerosols, to some degree through droplets, to some degree through contact, for example, shaking a hand. But it really seems that aerosols, this airborne spread, is the primary mechanism of transmission. And so that's important because that influences how you prioritize certain measures, perhaps more than others. And so I think all of the things we did to clean surfaces, frankly, is good. Hand washing is good, but I think what we did in terms of masks and ventilation were really the name of the game in terms of preventing that airborne spread. That's really what's been the most significant driver. And because droplets don't seem to be the biggest driver here, that 6 foot radius isn't really contributing to a reduction in risk. You're really getting all of your bang for your buck, so to speak, from the masks and the ventilation. And so that's really one sort of reason for that shift in guidance. And two, we've also seen some schools that were not able to keep students 6 feet apart, that went with 3 feet apart or so. We're also still able to control spread in the classroom as long as they were doing some of the other mitigation measures. Again, the masking, the ventilation, the testing. So this is really what resulted in the CDC having gathered this data over the past year, making a change in their recommendations. Now, I think one piece that I think could have been clearer is that when you do have students closer together, that can mean you have more students in a classroom. And when you have higher density, that means your probability of any one person in that classroom being infected goes up. So, one way to think about this is if I flip a coin, heads or tails, it's 50-50 chance I'm going to get heads on one flip. But if I flip that coin 10 times, I'm almost 100% sure I'm going to get heads at least once. And so similarly, the more kids you have in the classroom, the more likely at least one of those kids is infected. And so this really speaks to the need to make sure you really do need to layer other measures. Again, the masks, the ventilation, the testing, contact tracing, to make that work. And the last thing I'll just leave you with, I think, unfortunately, the people who make decisions about do we open schools to in-person learning or not, are not the same people who are making decisions about reopening businesses, for example, indoor dining or indoor bars, indoor gyms. These are decisions that are being made by different politicians and elected officials. And unfortunately, that has resulted in a disconnect very often. But what the science would say is that schools are much safer as places, in fact, maybe safer than having kids at home in the community where they may be going on unattended, unsupervised play dates, not masking, not in ventilated spaces. That the schools may actually be some of the safest places for people. But we know from data also that indoor dining, indoor bars, indoor gyms are some of the riskiest places you could be. And they are not doing many of these things. You're not masking when you're eating. Indoors, you're not going to have the appropriate ventilation in many of these restaurants and so on. And so these are places where, unfortunately, I think the reopening of some of these businesses and keeping schools closed has also created a lot of confusion as to what does the data say, and are these just arbitrary decisions. But if you were following the science, we would have schools open to in-person learning with the measures I described. And right now we would still have restaurants, bars, and gyms closed to indoor services. Finally, we are in the beginnings of a fourth surge right now. And I think it's really important for people to understand that this is not the time, big picture, to be being less vigilant about your mitigation measures. We should still be masking, even if we've been vaccinated. We should still be gathering with other people outdoors if you're not wearing a mask for some reason. So for example, if you want to eat out, do it outdoors. And we also have a new wrench that's been thrown into the situation, which is this UK mutant variant, what we call the B117 variant, which in the UK had led to such a big surge, they had to implement very strict lockdown measures again over the winter holidays. This is the same strain that has now spread across Europe. In Paris, their ICUs are overrun. They have announced another strict lockdown in France. Similar things are being done in Germany and Italy. And that is significant because the US has generally trended about 3 to 4 weeks behind Europe in what our pandemic looks like. So we're about 3 to 4 weeks away from something similar. If we don't take matters into our own hands right now and really double down on mitigation measures. I don't think as of right now that I would change my advice on what to do about in-person learning, but this also speaks to the importance of testing, because that's really how we keep our finger on the pulse of the situation and know in real time what is happening and whether we need to shift. And I think that's one thing that's really hard here is the science has progressed so quickly. And I think people just want to be told, okay, here are the facts, here's what you can rely on, here's what you can plan your life around. And unfortunately, because we are learning and sort of the facts, so to speak, are changing under our feet over time, you are going to have a change in guidance that reflects the change in what we know and the changes on the ground. So I think that, again, speaks to the need for clear communication, listening, and conversation.
Thank you for that really good grounding. We got a lot of questions. We're going to come back to them later, but I do want to ask you one quick thing before we go to the other panelists, because I know a lot of folks came here, as I said, off our petition about the 2-case rule, and you guys have talked, you and I have talked about this a few times, and I just want to make sure I have it right. And I think it goes to what you said at the end about using testing, and paying attention to what's going on in the schools, and that it's my understanding that, you feel like what we ought to be doing is increasing, using some of that American Rescue Plan money to increase testing in the schools, make sure cases are found and that classrooms are closed when there is a case, that we do trace who those folks saw, but that there isn't a public health reason to close the rest of a school building where you don't believe that there was exposure to that case, and that we could go ahead and end the 2-case rule and replace it with, an expanded test and trace program in them.
Yeah, I agree with that, Brad. I really think you should be basing decisions on whether to close a classroom or a school on testing and contact tracing. Again, what I was saying earlier about kids being safer at school than out in the community, we have seen this in that kids are, when you do the contact tracing, much of the infection is happening out in the community when they're socializing, not following the strict mitigation measures. And so that is a big source of transmission. It's important to differentiate, because if the transmission is not happening in the classroom, it means your measures in the classroom are working, even if you have a student who does come in who has an infection, that the masks and the ventilation are working. The other source I have seen of infection is among teachers who are, adult to adult transmission is, again, much, much more common than student to adult. And that the adults are transmitting, we see this in the hospital too, where adults will have lunch in a break room together or something like that, or maybe they're seeing each other after work and not masking and all the rest. And that's where you also have a lot of transmission. But I think the key here is you definitely want to be using that American Rescue Plan money to really ramp up your testing and continue contact tracing.
All right, I see all the questions in the chat to ask Dr. Gounder about vaccines and what difference vaccination makes. So I'm going to do that, but I really want to bring the other panelists in because we want to ground ourselves in the science, but we could spend all our time in it. So we'll come back and ask about, as teachers are vaccinated, as there's mass vaccination, what difference does that make? How long is that going to take to really change things? Does that mean we can be in a fundamentally different place in the fall? So stay tuned. But now I want to bring in our other panelists. I'm going to start with Shael. I know you've been talking to just so many principals and educators about what's going on in their classrooms. And I do think it's like, we've talked about having like a national memorial at the end of this. We definitely are going to need to have like Principals Day be a different kind of holiday than it has been, because what our principals and administrators have done to get through this is like a kind of heroism that I think we really have not honored very well. But just, talk a little about, what you see principals are doing, how you're talking about supporting them, and how, given what Celine said, you think schools are doing and need to be doing to be able to be supportive for their whole communities, both now and as we go forward.
Sure. I think one of the things that many in government don't realize is what delicate architecture exists in schools. There's hundreds and hundreds of small decisions that school leaders and their teams make each year as they plan for the coming school year in order to construct something that's going to work for children, for families, for teachers, and for everyone who works in the school. And one of the things that's been incredibly challenging about this particular year is that they've had to redo those decisions, and their schools are not organizations that change quickly or easily. And so we've made so many changes because of our efforts to keep everyone safe that it's put school leaders and their teams in such difficult position, because there wasn't enough money or enough staff to provide what students need and also follow the Department of Health guidelines. And so what we ended up creating was a terrible compromise, honestly. I think it is good that schools have been open to some extent in New York City this year, but I don't think we can say that they were open, given that, today only about 30% of our children are accessing in-person learning. And when you account for that 2-case rule and the number of kids that are doing Zoom classes while they're in school, it's probably more like 10 or 15% that are really doing in-person learning. And for the kids that aren't in person, the level of engagement and the level of support is really, really uneven and hard. It's definitely, there are a small minority, I would say, that it's been good for. And there are definitely some schools that have done really creative, thoughtful, heroic work on their virtual programs. But for the most part, many, 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 many kids are really disengaged from school. And it's I would say, a massive public policy failure. And so there's a tremendous sense of urgency at this moment in time to figure out how do we take advantage of this turning point that we're at? And I'd say about a month ago, when the president made vaccines available nationally for teachers, when the Congress passed the rescue plan, a lot of the dynamics of this question shifted dramatically. We now have all the pieces we need, I would say, to bring everyone back full time. The combination of what Celine was talking about in terms of our understanding of the science, the resources that are coming from the federal government, the availability of vaccines for adults and 16 and up, that combination actually does make it safe to create a plan now to bring everyone back full time. And I'm actually hoping that many families will opt back in during the current opt-in period that's happening, although I wish schools had a chance to develop plans and communicate those to families before the opt-in period was announced, because I think that there are many families around the city that are still worried and hesitant about sending their kids back to school. And that's because the school system has consistently disappointed them and failed their children over the years. And so I think we have a lot of work to do in order to communicate a plan about safety that actually convinces the vast swath of families across the city that it's safe to come back. And if school leaders and teachers in schools aren't part of that effort, and they don't understand and deeply believe in that plan, then we aren't going to see everyone come back. And so I think that is the task now, as quickly as possible. We still have 3 months left in the year. That this year, given that we started a month late, that's a third of the year. It's not too late to bring kids back this year, but we need to be working with all of the city's resources, I think, to support school leaders and their teams to construct plans that would make that work. And I think at the point that that happens and we really build confidence in communities across the city, that's when we're going to be able to move back to something akin to normal. And there's still going to be constraints because many kids won't be vaccinated. But I think that many of the constraints that led to this hybrid model will fall away.
All right, thank you. I know we're going to get a lot of questions to follow up on that as well. And just I appreciate the perspective, which I think is really just right on, and also the work Bank Street is doing to support it. Let's go to José next. You're wearing a lot of hats here. You're wearing the hat as a 15-year teacher, so you're in dialogue with lots of teachers, and obviously there's been lots of frustration about what it looks like for showing up and centering health. Obviously more and more vaccination, but still lots of people working really hard and lots of concerns. You're a parent, and you've been at the center of fighting on issues of race and inequity in our schools over a lot of years. And I think actually both Celine and Shael spoke to the ways in which those people who have felt that the schools have failed them are, of course, much less likely to have any trust in the system. And so it's no surprise that parents of color would be more hesitant to be sending their kids to school right now. So how do you think, from those just multiple perspectives, about what we can be doing and what we need to be doing to rebuild confidence in that education system? And that's like both a short-term question and a long-term question, and obviously especially in communities of color.
It's interesting that you mentioned that, because I feel like there needs to be a political and educational reframing about what New York City public schools are. We understand that 85% of our public school system is actually students of color. We also recognize too that whenever some of our schools get a certain level of benefits, then other schools may or may not see that, depending on their race or their culture or their standing and all that other good stuff. I think we really need to be conscientious about the messaging that started this pandemic. So when we think about it, if we had started with a united message about mask wearing, social distancing, washing hands, just those three things alone, then I think we could have done a much better job of handling all this. But unfortunately, what happens in our schools is going to be a function of what happens in our country, because education is a function of what happens in our government, right? And so a lot of what I'm not hearing, and I would have loved to hear more of, is how so much of these political strifes at the federal, local, and state level have often led to so many of us feeling uncomfortable about trying to go back into an institution that is mandated by the local, state, and federal governments in question, right? So, for instance, I think about so many of the dozens of colleagues, for example, who passed away, bless them. I haven't heard much in the way of, I guess, apology from either the mayor or the president or anybody else in the, I guess, in the act of contrition, in the way of saying like, hey, like we could have done that a whole lot better. We should have been united in the front. And then to the question around science, I feel like even the question of science had been politicized for at least the last 4 years, right? And without those thought processes in mind, then it makes it even harder for folks who are consistently ostracized, consistently oppressed, and marginalized across, race, gender, our LGBTQIA folks as well, any number of different folks who are not being considered at the center of our education are going to consistently also lose trust in these systems. I remember when I wrote an article with Lynn Shan, Why We Can't Go Back, around these issues. And it wasn't even about the science, because as it turns out, like, I haven't caught the flu, by the way, since last February, because all I did was wash hands, put my mask on. Like it was a religion for me, and I'm Catholic, so like, unfortunately, like that was my second religion. I was already on that, right? But when I heard so many people, they said, like, I'm not hearing a united message. I'm not hearing this united front. And then furthermore, I think about my time as a school teacher and how often I would ask for different supplies and I wouldn't get them until months after. I wouldn't get the right books, the right pencils. I mean, can you imagine trying to get PPE with the same system without that sort of level of trust, without that level of efficiency? There are still students who still don't have the high tech that they need in order to keep up in classrooms. There are still folks who are still, like, there are parents right now who are literally trying to fundraise for their kids' education in our public schools. Our public schools should have been at the forefront of handing out all the technology, and it shouldn't have to depend on grants that are coming from outside the school system to ensure that all of our kids have the right technology to keep up with school. So in the ways that we think about trust, these are systemic failures. And what's more, and I'm reading the chats and I'm thinking about this, 88% of teachers, 88% of parents trust their local school teacher to give them the right message around the pandemic. That's a lot of teachers. That's a lot of educators. And unfortunately, we haven't leveraged that power, the local teacher, to be able to say, here are some ways that we can actually do this a whole lot better. I found the most powerful message throughout this pandemic, mind you, was the rec center, right? So like those regional enrichment spaces were really powerful especially for our essential workers and for our children of color, because they all saw, oh, wow, there's a way to do this responsibly, where we thought about the students who are in special education, our special needs students, our students who are multilingual learners, our students who most desperately need that face-to-face learning first and foremost. And we thought about them first, and regardless, and because of their own backgrounds and their composition. But without that sort of, like, again, united message, united front, then you're going to consistently see an inconsistent message about which schools need to open, which schools need to close. Oh, like this one was closed for 7 days, this one was closed for 1 day. How does that help us gain confidence when the foundation of public education feels like it's rattling underneath us? And then not to mention all the folks who still want to do standardized testing, high stakes, and try to make us do these sorts of things in the classroom, when we know for a full fact, like, this was already inequitable as it stood. Like, why are we trying to talk about learning loss when we already knew that we lost so much more than learning?
I think that's really powerful, and it's a good grounding for something I want to come back to, because obviously you see in the chat there's a lot of this debate about, with vaccines, can't we just tell teachers they have to get back in the school? And I just want to say, as somebody who, and we'll come back to this, I think the 2-case rule should be ended now, and that's on the mayor. It's the mayor's decision. That's not something that's in the contract. I believe we can have full opportunities this summer for every kid who wants it. And I believe we can have our schools open in the fall. But I guess I really do also want to say this. If we don't have a school system where teachers feel supported and have confidence and have solidarity and feel like they're part of educating their kids, and we keep that thing where people trust, 88% of the people trust their teachers for that information, then we don't have a school system. So the work we have to do to build to a different place in which there's just something like solidarity, and not like a fight about what it's going to take, but a shared commitment to get our schools open, for all our kids with teachers who feel supportive and safe, like that's what a school system is. So I understand the frustration in the chat on all the sides. And I guess I would just say, like, if we keep it there as though it's a fight, we'll all lose. And again, I think the mayor should end the 2-case rule. That's up to him and not up to the union. Some things are bargained and some things are not bargained, but it's our teachers that are not just human beings, but the ones who are doing this work. So that's part of the goal here, is just make sure that we're building together. And actually, we'll come back to Jose, because he had an opportunity last night to talk to the new schools chancellor in a conversation that Educolor did. And I've heard her say she wants to get the 2-case rule ended, and she wants schools open, 5 days a week for all our kids in the fall. So I want to hear a little about what we think she's going to be able to bring to that. But before we do that, I want to bring Emma in. And Emma, I think let's just go back to where you started when we began. We talked about what we want to see on the other side of this. You've been fighting for more integrated schools. You've been fighting for schools that show up for all their kids equally. I think we've heard that that's actually would be a pandemic resource, that those students and families that have felt their schools were able to be safe and supportive places for them have also had more trust and ability to lean in. So how do you see that we build from where we are to something that really reflects what you and other students in Integrate NYC and the Coalition for Racially Just Public Schools have been fighting for?
Yeah, well, first, thank you so much for having me. I think education equity organizer and activist Tanisha Grant would actually said something that I thought was really powerful. And she, as a Black woman with Black children in public schools, was saying that, if the Department of Education wasn't keeping her children safe in school before COVID, that like how can her and so many other parents and students and community members think that they would keep their children in schools safe there now and after. And I think so many other people touched on that, and how like the enormous and very valid distrust that people have. So yeah, I think like to start, I think impacted communities need to be central in reopening planning. I know that the mayoral task force in New York City did very little to solicit really meaningful feedback or partnership with community members, even though, you kind of put the community members on a task force, but then the task force is just kind of there. And the really authentic input and partnership didn't exist. And then I know that Governor Cuomo's task force for reopening schools actually had zero representation from any New York City students, parents, principals, or teachers. And so I think that first and foremost, when we talk about reopening and planning what this is going to look like, that stakeholders need to be central in not only giving feedback on the process, but in designing that process. But in terms of what schools can look like at the other end of this, I think that COVID-19 has just served to exacerbate so many pre-existing inequities in our society and in our schools that, advocates and people, advocates have been highlighting, but people have been experiencing for long before COVID had occurred. So I think that this is a opportunity for us to really not only be responding to the pandemic, but to be creating real sustainable and transformative solutions and preventing things and the kind of like the hardships that were created by the pandemic from happening again, and restoring really historic harm that has been done. One of the ways that I think that we can see that is through a change in admissions policy for New York City. New York City is the most segregated school system in the country. It's also the largest school system in the country with 1.1 million students. And 10% of New York City public school students are either unhoused or in temporary housing. And especially with COVID-19, now our living conditions are also our working conditions and our learning conditions and our testing conditions. And so in terms of admissions, which is one of the key factors in that has been kind of reinforcing segregation in our schools, one thing that Integrate NYC and territorial empathy had developed, and here I can drop the link in the chat as well. We developed a project called Segregation is Killing Us, where we considered, ooh, okay, I'll figure out the link after this, or here, this should work. Never mind, there's a bunch of numbers. But anyways, we created what's called like a student priority score. So for a really long time, we were kind of thinking about how we can redesign the high school admissions process and algorithm into one that is more equitable and one that does not reinforce segregation. And then when COVID hit, we were thinking, okay, what is a way that we can repair harm that has been caused and support the most historically marginalized students? Because the communities and neighborhoods that have been experiencing the most inequities in their schools and the least resources and the most criminalization are the same communities that have been hardest hit by COVID. And so we were thinking, why don't we create a kind of an added pillar and element to the admissions algorithm, where we're not just looking at your middle school, we're not just looking at your grades or your test scores, but we're also looking at elements of your identity. So in the score we created, we weigh COVID-19 data heavily, but this is something that we can use past COVID, where we can be looking at if you're an English language learner, if you're on free or reduced lunch, where you live, if you have a parent who has been incarcerated or formerly incarcerated, and considering these other elements of students' lives in their admissions. And that way we can kind of find ways to support the most historically marginalized students and recognize that meaningful integration is not just desegregation and moving bodies and changing demographic statistics. And it's not just about an end to discriminatory screening, but it's also about instituting inclusionary and non-discriminatory screening, right? People often say like you are racist or you're anti-racist. And so this is kind of a solution that we came up with that can be a response to COVID and recognizing the schools and the students that have been hardest hit by this pandemic and finding ways to support them. But it's a tool that we can use to kind of support the most historically marginalized people in the future too, using data that might, right now we're using COVID data, but we can be using all sorts of different types of data in the future. And this is something that we built with students and teachers and communities and data scientists at MIT. And here, let me see if the link works now. That should work. So yeah, I think that one of the central things that I would love to see after this pandemic and in our COVID response is not just looking at the Band-Aid solutions of, how we can kind of plug the holes of all of the floodgates that have opened, but looking at how we can kind of shift the root causes of all of these issues and looking at how we can meaningfully integrate our schools. So then this kind of impact will never occur again in terms of education injustices.
Thank you, Emma. I really appreciate that. I know some people want to get back to focusing specifically on like what's it going to take to reopen, but I think helping us think about what it looks like to ground schools that really show up for all their kids is an important thing to do from this moment. And I just want to flag also that I feel like modeling what it looks like to be resilient and organized together and work together to get through pandemic is a huge part of what we're all learning right now. And people are not going to remember like who signed the Treaty of Ghent, but maybe we'll figure out what it took to overcome a pandemic collectively. And like, that's actually pretty important knowledge. So I'm gonna get back though to a few of those questions. So I'm gonna answer one that I feel like has been asked over and over again about like what I'm doing and what we're doing on the 2-case rule. I wanna then go to Celine and ask about vaccines and this question of like, if our teachers are vaccinated, isn't that enough? What can we expect from when vaccines will be widespread enough to make a real difference? And especially, I guess, what does that mean for when we can really be reopened safely? And then I really want to hear from José, followed by Shael on sort of the new chancellor and like what we can see looking forward. But let me just address the politics quickly, because that has been really addressed here. So I'm going to be real clear on the 2-case rule because it was asked in the chat. Yes, there was a handshake agreement over the summer between the mayor and the UFT to try to make sure that teachers didn't, feel the need to go out on strike, but it didn't modify the contract. There's a contract between City Hall and between the city and the UFT that is bargained, and changing that would have to be rebargained. The set of protocols and safety that were agreed to around COVID are essentially a set of things the city agreed to do. And it is the mayor's choice. Like, the mayor does not need to renegotiate or bargain the agreement differently for the 2-case rule. And if he wants to say tomorrow, here's the new protocol for we've got the American Rescue Plan money, we can expand testing and tracing, and we're going to go ahead and do that as we bring kids back into the classroom, with the opportunity that was offered. That's where the decision lies. Like, that's the decision maker whose decision we have to change. So we got to keep up the pressure on the new chancellor and on the mayor. They are the ones who are going to make this decision. And I'm going to keep being as loud as I can and take every chance I can to ask both of them. I hope other people will hear too. You can choose to, focus on anyway, let me just leave it there. So that's the perspective I have on like who the target is and what change needs to be made. I really want to appreciate the folks working in the chat. I'm going to thank Naomi and Steph for their big work to kind of fend off the trolls. And they're working as hard as they can. We're hesitant to close the chat, because it really is vibrant, even for people who disagree pretty strongly. Like, this is an important part of how we at least try to do our best to have as many people as possible feel heard. Okay, Celine, can you take on the vaccine question?
I think it's really important to ask two separate questions. One is, what will it take to make teachers and other educators, staff feel safe to go back to the classroom? And what will it take for families and students to feel safe going back to the classroom? And I have to say, I was really concerned with the announcement about prioritizing teachers for a couple reasons. One, from an equity perspective, teachers across the country, and this was a national announcement, not a New York City announcement, teachers across the country do tend to skew younger and whiter. And so by prioritizing teachers ahead of other groups, that is driving some of the inequity in vaccine allocation. Is that trade-off worth it if you are able to open schools and people feel safer about going back to school? Perhaps. But if your students from communities of color, families of color, still don't want to send their students back to school, I think that continues to perpetrate inequity in the system. So I think we need to sort of tease out the two. For teachers, if they are vaccinated, first of all, the conditions that have been created between masking, ventilation, testing, contact tracing are safe. So you don't even need to have vaccination for a safe return to in-person learning. There's no question that adding vaccination to the mix is really robust and essentially brings that risk for teachers to zero. For students, it's a bit different. There will be access to vaccination for adolescents before too long. Already 16 to 18-year-olds will have access very soon. And then some of the younger students, you may have heard the results of the Pfizer vaccine data, which was found to be safe and effective in children ages 12 to 15. Pfizer and Moderna are also now looking at younger kids. Johnson & Johnson is looking at adolescents as well. So I think you're going to have a number of different vaccines that receive emergency use authorization from the FDA sometime mid to late summer for use in adolescents first. And then younger children, you'll probably see that data followed by FDA emergency use authorization early next year. So I think the calculations are different. And from what I have heard, and I would really again like to hear from families here, from what I have heard from families is that they're worried that their students might get the virus and bring it home. And so it's not even that they're worried that their students will get sick, it's that they will be carriers for the virus and bring it home to people at home who are high risk for disease. So I do think that concern needs to be addressed. I do think it is one protection there is we are seeing a big opening up of vaccine supply over the coming month. By May 1st, again, across the country, every single adult in this country will be eligible for vaccination. 90% of adults will be eligible for vaccination by April 19th, so it's quite soon. But just because you're eligible doesn't mean you can get a vaccination appointment right away. And so it will take a couple months for everybody who wants to get vaccinated to be vaccinated. I do think by middle to late summer, all of the adults in the city who want to be vaccinated will have had the opportunity, will have been able, not just eligible, but there will be enough appointments available by that time. And the outreach into the community is definitely a priority under the American Rescue Plan, trying to distribute vaccine through community health centers, through mass vaccination sites, through other kinds of community outreach. So I think a lot is really being done to make sure that happens. I think, again, your older students will have the opportunity to get vaccinated before too long. So then it really becomes a question of, are families worried that the youngest students could bring the virus home? And if you're implementing those other mitigation measures that have been working all along, I think the risk is very low. But you're still dealing with a trust problem here. And when there's been a breach of trust, when families have been given reason not to trust, whether it's the Department of Education or other institutions, that's really a different issue, and one that's going to require a lot of outreach, a lot of listening, and responding to some of the various concerns, some of which may not seem directly related to COVID, but really are about rebuilding trust.
So as I transition back to José and Shael, it sounds like you believe from the science that our schools can be open in the fall, with vaccine spread 5 days a week, with, kind of all of our kids back in them, that there's questions of what it takes to make sure there's trust for people to do that, what it means for, but that the science makes, you believe the science says that. And I think that's a good transition to José and Shael to talk about what it looks like to make sure the system is supporting that and what needs to happen for that to happen. I know there's a couple of high school parents in the chat saying, I'm really trying to make decisions about the fall, and I haven't yet seen from my principal clarity that they're going to be able to reopen in the fall. They're hearing that half their teachers are seeking accommodations. Will they be able to plan? So I guess what I want to ask you, especially from your conversation last night with the chancellor, is do you think that we're going to be able to, what's it look like for the system under the new chancellor's leadership to make this set of things happen, to bring those kids back, the 25,000 or more who have said, I want to get back in the classroom, to move to end the 2-case rule so there's more stability, and to get in a position where we can open in the fall, something close to, in the ways that will support all our kids full time. That's a lot, but tell us about your conversation with the chancellor last night, and whether you think, how she's going to lead and what we can do to make sure it happens.
Well, what I will say about Misha Ross Porter is that in addition to, being the first Black woman to lead NYC public schools, I also recognize she's a fantastic educator who a lot of people have her back because of her work in the Bronx. So she does have a lot of supporters. These are good things. So I'm going to contextualize my conversation in that, because of course, I do have to make sure that, she can speak with her own voice. But here's some major themes that are worth recognizing. The first is that student learning conditions are teacher working conditions. So anytime that we talk about students, we are in effect talking about teachers, principals, ESPs, any number of student-facing adults. So we need to think more carefully about how we split up that conversation and find ways to more unify that conversation so we can have a better conversation about the ways that we can actually unite. The second part is that, for someone who worked in a community with a lot of essential workers, I don't think that narrative has gotten enough out there. I remember when we supposedly closed schools in March, and then we had to go back for about a week, not knowing how the pandemic was going to go. And within a matter of about a month, we had a student whose father passed away. That's hard to reckon with. And that's a trauma that I think people have yet to really realize, is that there may be communities where, you have maybe 2-3 degrees of knowing somebody who had passed away from COVID. But those of us who are teachers in neighborhoods where there are a lot of essential workers, that degree was down to like 1. It may have been the person who you saw at parent teacher conference. It may have been that person who you saw at the games. It may have been that person who you go get lunch from. So people who like to talk about like the ways that schools are open and closed don't really recognize that there are actual people who are standing in these positions that we call teachers, that we call principals. Imagine the sort of effort that someone like me, who does actually care about each and every one of his students, had to make during that time to get that kid the education that they deserve in the midst of a pandemic where their parent and their family members had passed away because they were all essential workers. We have to think about too, how if we are as a city thinking about reopening schools, what are we willing to do so that this never ever happens again? And this is where I have to lift up folks like Emma and the work of Integrated NYC, Teaching Charge, Urban Youth Collective, is that when we think about the children, our children, are we just thinking about my child, or are we thinking about other people's children? Are we thinking about all of our children? What are we willing to sacrifice together to assure that every child, especially those who are consistently at the brunt of so many of these different education reforms, what are we willing to do for them to make sure that this sort of situation never happens again? And if your conversation around reopening schools disregards so many of those parents, then we're going to be back at square one again, because so many of the kids that are being served by our public school system happen to be at those margins, happen to be the kids of essential workers, the grocery store workers, the DoorDash workers, the nurses, any number of different folks who may go unnamed, that work in the shadows of the services that we consistently get. We have to be the teachers and the folks who go service the students who need those sorts of services from us in a way that other folks may have different options, and that's all well and good. But I consistently have to think about Washington Heights whenever I'm teaching. And I'm sure people feel the same way. Even in Harlem, I live in a space where, for example, in March, I was hearing 10 sirens a day while I was teaching. That's difficult. That's hard to reckon with. And I'm asking people to be more empathetic and more sympathetic, especially to folks who live in the communities in which they serve, who are consistently thinking about the kids, and the principals too, who are consistently having to manage any number of different pieces while they are working with schedules as well. They are working with actual human beings. And so when we reopen schools, I would love for parents who have these sorts of options to be thoughtful of the folks who don't necessarily feel they have the same level of options and autonomy and political power.
Thank you. I want to note we're a little over time, but I hope and if our panelists need to jump, we only, the contract was only for an hour, but if you guys are willing to stick around, I think there's a lot of folks, we're still, well over 100 people in this thing. So I'm hoping we could keep going for a few more minutes. If you need to jump, just like wave and let me know so I could get your final thoughts before you go. But I want to ask Shael now. I think in some ways José's comments, especially combined with some of the issues in the chat of, especially from not only high school parents, but high school parents who are asking, like, am I going to be able to count on my principal to reopen the school? Are they going to be able to have the teachers in there that they need? What's it going to look like? They're not getting the information that they need from the DOE on the one hand. They're not sure whether they're going to have the resources of that funding. They're not sure whether their teachers are going to be required to come back or going to come back. So how do you think it's going to roll out that those principals are really the ones who have to run the buildings, are going to come to have what they need? Starting right now, as obviously they've got all these kids who have just signed up to come back into their schools. So they got to figure out pretty quickly how they're going to accommodate all these kids coming back and then rolling on through the summer and into the fall.
Yeah, I think that with the news that the vaccine works well with kids over 12 this week, I think we'll actually see most high school students also vaccinated this summer before school opens. And those are our highest risk children in the school system because they're most susceptible to getting the virus and passing it along. And so I do believe that by the fall, we will be able to open all of our schools in person full time. I think that there are going to be some constraints that we have to attend to because our younger children won't be vaccinated yet. But I think it's possible, as Dr. Gounder outlined, to do that even when children aren't fully vaccinated. And so I think part of the puzzle for the school system right now is to imagine forward, to actually start this intensive planning to get everyone back now. The longer we wait to sort of name that very explicitly as what's going to happen, and set really strong goals about when it's going to happen, the less time we have to do the work of building the solidarity that you described, Brad. I think vaccinations is one area where we need to do work. I think right now we're probably at about half of our workforce in schools vaccinated, even though it's true that they've been eligible since January 11th. Until a couple weeks ago, it was really hard to find an appointment if you didn't sign up that first weekend. And so many of them didn't get vaccinated, and many are hesitant about getting vaccinated because it's a new vaccine. And if you're a person of color who's interacted with the healthcare system in New York City, particularly during this pandemic, you have good reason to be cautious about what you're being told, and not to take it necessarily at face value. And so there's an education process that is needed within each school community and across the city to help folks process their questions and concerns about getting vaccinated, not just in schools, but beyond that as well. What I've found is that as you create resources and spaces for people to have those conversations, and as folks see their family members and colleagues getting vaccinated, ultimately most people make the choice to do it. But it's not an automatic thing for everyone. And we have to actually have a plan to help educate and create those spaces. And I think similarly, we have to talk through the kinds of questions José has been raising inside communities across the city. And I think he's right that teachers and principals actually need to be central part of that conversation, which is one reason I'm really happy that Chancellor Porter took this job on at this moment in time. She's been at every job within the school system. She really understands well how to build and listen in building coalitions within communities. And I think she's going to be a really powerful leader at this moment to help us have those conversations. And those things aren't going to happen quickly. They're going to need to happen intensively. And the faster that we can begin them, the more chance we have of getting back to stability in the fall. And so my hope is that in addition to sort of short-term objectives like the 2-case rule that folks have been talking about, which I agree with Dr. Gounder can be removed if we have more testing very quickly. I think we also need to be working on these other efforts in parallel. And I think that's something that everyone on this call could have a role to play in. It's not just city leaders that are going to need to do that work.
Let's stick on this for a minute, because I think it's a really good point. The idea that urgency needs to be put into kind of providing a North Star of, a full-scale 5-day all kids reopening in the fall requires clarity, like a lot of planning, and like clarity that we're doing it, and then engagement of the people that have to make it happen. I think it might be worth talking a little bit about how we organize for that, so people could have confidence in it. Like, what does it look like? I have heard the chancellor at the hearing we had 2 weeks ago, where I pushed her on the 2-case rules. She said quite clearly, I want the schools open 5 days for all kids in the fall. The mayor has said a version of that, although a little bit softer. How do we push together for something that kind of sets that up very clearly as the goal we have to do this forward planning for, and then make it possible for people in their schools, in their communities, to get what they need to be a part of making that happen in a way that, you've planned for this system writ large. So what does that look like? How should we be organizing to really make clear that that's what we're all working together for?
Well, I think it starts with giving a really clear message from the mayor and the chancellor to principals about what that goal is, and ensuring that they understand what constraints that they have to work within. And that is where we've been tripped up so many times during this pandemic, is that the folks who are making decisions at the public health level don't understand how many layers it takes from a point where they make a decision to actually implementing it in a school across thousands of schools. And so now is the time to be framing what are the constraints that we need to contend with, even though we don't know everything. We just have to put some markers down and say, you know what, there has to be a way to get everyone back in person. Here's the safety measures that we're going to have in place to keep people as safe as possible. And now, here's your budget. Like, this is going to be the best budget year in the city's history, probably, in terms of money coming in from both the state and the federal government. There's a lot that we can do with those resources to get reopened and also to address some of these deeper issues. And so those budgets need to come out now, like in the next few weeks, so that folks can start hiring. This is the time where folks are hiring teachers and planning for the next year. So those are key steps. And I think in parallel, you need to also stand up sort of public campaigns with trusted folks from communities across the city involved in educating both about vaccination and also about how we're going to keep children safe in schools, so that parents are willing to send their children back and believe it's safe, and that the staff who work in the schools get vaccinated, and as many children as possible get vaccinated too.
Thank you. I think the budget point, I'll just say a word or two on here. Some of you guys were involved in this fight that we had starting in November that we only finally won 10 days ago, just to let the schools know they weren't going to have to pay back the money, from register loss, hundreds of thousands of schools. We cannot afford to have it drag on like that. The American Rescue Plan money is $4 billion that Washington is sending to the DOE directly. It's not going through the state. And it is time now to make sure principals know the money they're going to have in their budgets, like the way to be able to answer the questions, what are things going to look like? Who are the teachers going to be? Is to give them those resources right now and make it possible for that to happen. So I think that is another really good thing that we got to be pushing for. Let's see, I think we should try to answer a couple of these questions in the chat about authority. Both given that the mayor is going to be a lame duck, and what does that mean for the fall? And a little more, as honest, and not as honest as we can be about the UFT, like as straightforward as we can be about how some things work here. So I want to open up conversation. I don't know whether José or Shael is better for it, but I'll kick it off, and then I'll invite them to maybe chime in as well. I guess I want to talk about what's legal in terms of contractual. There is a contract between New York City and the UFT. That's a legally binding document, and that provides how much teachers get paid and what you get paid year after year and how many days you get off and what the school calendar is. Those things are in a binding legal contract and would have to be negotiated, and this would sure not be an easy time to open up the contract and try to change those things. The rules around COVID and what decisions were made, whether vaccination will be required, how they will deal with the accommodation requests, and whether we will say, if you've got a vaccine, you got to be in your classroom, by the fall, if not sooner. All of those things were done essentially on a handshake between the mayor and the union last summer as the schools were planning to be open. They're not in the contract. They do reflect that the union builds political power to show up for teachers, and they felt a lot of pressure from some of their members to strike a deal with the mayor. Obviously, some people said, if we don't feel safe going back in, we're going to go out on strike. So there was a handshake that framed a lot of what happened this year. But all of the things that we're talking about right now are not subject to collective bargaining. They're subject to making it work, and so the mayor could, and the chancellor could, and the 2-case rule tomorrow. They could say, we're going to get the schools open in the fall, and we're going to do the forward planning that Shael just described with providing the budget, and here's some guidance. Obviously, it's also critical that principals are able to work with their teachers and build what they need And the union matters a lot in the long term. So like there is a lot of layers here. The politics are a layer, the system and its how it functions is a layer. The union is the dynamic between the principals and the teachers in an individual school, as well as the dynamic between the UFT and City Hall. So like that's just the reality of political power, and you can't wave a wand to change it. Organizing to get the things we want done from this call, I believe we can do. I think the best way to do it is to try to organize something a little more collective. And that's why we tried to do this call this way. This is a call organized with a lot of people who want to get kids back into school safely but faster, and a lot of people who want to do it in a way that's durable and builds collective power, both because like that's the only way we're really going to win it, and because it's what would really matter in making schools be able to show up for all their kids. So like that's my take, and it's an honest answer on a combination of the politics and like the realities of a system this complex and how we try to organize it to show up for the full range of stakeholders. I wish it were easier, but that doesn't mean there's not urgency to it. It just means we've got to combine urgency with that kind of multi-stakeholder planning that I think all our panelists have been talking about. But I guess Shael, you know, you've lived these, well, both Shael and José, you lived these dynamics a lot more on the front lines than I have. So anything else you want to
there? I would say that the same kind of process that we were just talking about in communities also needs to happen amongst teachers and within the union. So it's not something that you can just snap your fingers and say, okay, the thing that people feel has been keeping them safe is now going to go away and everyone's going to feel okay about it. So I think there is opposition within the union right now to changing the two-case rule. And I think that opposition stems from a lot of mistrust because of how things have gone this year, and mistakes that have happened in that relationship between City Hall and the union. And I think that there needs to be a process. The union leadership needs to believe that the reason that rule was put in place has shifted. And I think it has shifted, but that doesn't mean that you don't put something else in place to add a layer of protection. And I think that what Celine said is right. Like if we increase the level of testing that we're doing, and we have the resources to do that now, the reason the two-case rule exists in the first place is it was assuming that you couldn't tell because you didn't have enough data from an individual school community, since you're only testing a small portion of the kids each week. You couldn't tell if there was an outbreak in the school if you couldn't rule out the possibility that there was an outbreak. And so there might be one if there are two cases that you don't understand where they came from. And with more testing, you actually can rule it out. And so I think that is the kind of agreement that could be made. The city could increase testing in exchange for removing that rule. And then the union leadership would need to talk with its members and explain why that change is being made. And I think then it could be made. And so I think that actually may be happening now. I don't know, but that would be the smart thing to be doing at this moment, because it is keeping a lot of kids out of school unnecessarily. And it was too strict a rule, given what we now know. And that's just an example of, I think, what work has to happen. And again, I think the new chancellor has an opportunity here because she can build that relationship on fresh ground. And I think that that'll be an important part of this next phase.
I love what Shael had to say, because even as people talk about the relationship between the UFT and DOE, I also want to remind everyone that the most poignant rebuke of school reopening actually came from the principals, and it was from a technical standpoint and not as much as it was a social emotional standpoint. So, you know, I live with someone who happens to be the best educator I've ever seen, who's my wife, and you know, she sits there, assistant principal, she's programming all the classes, and anytime that there's an announcement on that Friday night drop, you know, and any number of classes are going to change. And so that's a worldview that I had to take into account when it came to school reorganization. Like, yes, I do believe thoroughly that the science needs to overtake this conversation. And again, we need to go back to this unifying message. There's a few things that I think are really critical to making sure that this actually works in terms of school reopening, that I think from a sociological, because that's my like arm right now, is like thinking sociologically, what would be best in terms of getting people to really trust in the school system again, especially when you're probably going to see a mass exodus, not just of like parents, but frankly, teachers and principals. You're going to see a lot of retirees. You're going to see a lot of folks leave because of this incompetence that we've seen over the last year. One thing that I would love to see, for example, is perhaps, placards pasted all across the wall saying, here are the 3 basic measures you should be using to, help us beat COVID. That could be one. The second is, because so many of us teachers got vaccinated, it'd be really cool to see more politicians on the local level actually, push up and make teachers ambassadors for the vaccine. We haven't taken into account how social media companies had allowed for any number of disinformation campaigns to take over the public conversation in the national zeitgeist. So if those of us who've already, been vaccinated twice and, got the 2 shots or the 1 shot, depending on what you took, and we've come out on the other side of it, it'd be good if those very folks who cared about communities already, who are in touch with so many different parents already, were able to actually get out there and say, here are some things that I did and they are all safe. Like, I'm not sure why we're not doing that. Like, too much of it is very much based on what's happening with the leadership, as far as like, Michael Mulgrew, Bill de Blasio, Canizaro, so on and so forth, and not with the teachers who are in the communities doing the work consistently. I would also say too, that yes, I think a lot of us are afraid of striking, but there are times when the dog wags the tail, and there's the times when the tail wags the dog. So last year, it wasn't the U of T who was pushing for a mass sick out. It was the teachers who were pushing the mass sick out, and the U of T had to catch up. Like that, we must, stay with that reality, because that was happening. And so in the ways that, yes, Brad, just as you said, Brad, being able to say to ourselves, these are the things that are happening. And so with or without U of T leadership, there are things that are going to happen in different pockets. And how do we get ahead of that? How are we proactive about school reorganization? It has to start with having better conversations. It has to start with having more communication channels between local communities, local teachers, local schools, and then trying to find ways to continually create unifying messages so that folks like Bill de Blasio and Andrew Cuomo and Joe Biden can actually hear from us directly about how best to reopen. But without that unifying message, without a framework for how we're going to do this well, and make sure that everybody's jobs can be done effectively, then it becomes even harder for us to get that trust from communities which otherwise don't trust so many different people all across that ladder.
Thank you. I want to move us toward closing, because we're just about at 8:30, which is 50% of the time over that we've gone. But I want to try to do just one thing before we do that. I've invited my friend Amy Sandeman on screen with us, because I know, and I can feel in the chat, that there's a parent energy which is listening and which is supportive and which like wants to lean in, but is also got a set of frustrations that I don't want to just leave bottled up in the chat all night. And Amy's somebody who I know who's given her whole life on the issues of equity we've been talking about, and sees how hard it is to make government work and wrestle through bureaucracy, but is also a high school parent, like trying to figure out, is my school going to be able to deliver to my kid what she needs or not? So I just want to invite Amy to kind of come reflect a little here, what it's been like to listen to this, what you still need to hear. And then after that, we'll give each of our panelists kind of one last chance for a closing word, and we'll wrap up.
Thanks, Brad. And thank you to all the panelists. This has been such a wonderful opportunity. Yes to everyone, like yes to the science, yes to the young people, the young women, all the youth who are really thinking about how to use this moment of chaos to change the frame and to really reimagine how schools can be more equitable. And yes, that I've spent my whole life working towards making New York City a more equitable place. And yes, I'm worried about my own kid. I'm really worried about my own kid. I have 2 high school students. The one I'm most particularly worried about goes to Murrow. It's a really big school. And I've been part of a group of parents who are organizing with sort of a 2-pronged approach. The first is like, we want to be behind our principal and support him as much as humanly possible to have 5-day a week in person, real life education in the fall. We sort of given up, honestly, on the spring. I think I agree with Jose that there's like the community-based piece is important, but it's really not enough. And especially with the high schools that seem not as connected to the district, it seems like every principal is just like faring for themselves. And if like the principal's creative and can figure it out and somehow has a good layout in their facility, they can do better. And otherwise, you know, you're sort of in trouble. And the second prong is really trying to connect citywide to other parents and to message to the mayor and the chancellor how important this is, and really get them to make a public commitment to have a shared vision for reopening in the fall and backward plan and figure out what's it going to take. Look, you need more space, close the streets, put portable classrooms. That's a solvable problem. I mean, the concern I think that a lot of parents that I've talked to had is around the UFT. It's not like teachers and parent-teacher conference are like, I want to go back, but then we're hearing from the union leaders in our schools, they're like, we're not going to be back for years. They're saying this in public meetings. So I think, you know, that's real, and parents are really worried. I think a lot of parents don't realize the principals have no plan of how they're going to get back in the fall, and that we have to start talking about it now. So I'm really grateful, Brad, that you're opening this space, and we want to be positive and supportive. But I think there has to be some noise for the mayor to feel convinced that this needs to happen. And, you know, in June, he's going to be a lame duck, and we'll know who our next mayor is to the primary. And hopefully we'll know who our next comptroller is too. And so those next mayoral candidates really need to understand, but they're going to have no power between June and when they're inaugurated in January. So I feel like between now and June is a really critical time for us to find a shared vision, really clear calls to action, in a positive, like constructive way. But I think that UFT piece is really confusing to a lot of us, because we want to support progressive unions and we want to support teachers and we don't want to be against them. But at the same time, it seems like this intractable power that we're confused and are seeking like a path forward. Thanks, Barb.
Thank you, Amy. That was really well said. And I think there's a lot of it's resonating in the chat a lot. So I think you're speaking for a lot of parents there. So let's do this. I want to just give, 1 minute each for kind of some both response to that and close out comments from our panelists. And then I'm going to make a few commitments at the end, because I see a lot of the questions like calling on me, like, what are you going to do both in your time as a council member, Brad, and if you're our next comptroller? And I want to make a couple of commitments of things I'm going to do with the folks on this call as we close out. But first, let's just go around, and I guess we'll do it in reverse order. Since so why don't we go Emma, Jose, Shael, and we'll end again with Celine.
Yeah, so I really do think that like meaningful integration and proper housing and equitable healthcare, like these are things that are prevention. And these are things that, I think a safe and supportive school and a roof over your head is healthcare in a sense. And so I think that when we're looking at school reopening and when we're looking at education justice, that it's not just about reaction to COVID, it's about kind of a fundamental change in how we're approaching schooling as a whole. And I know a lot of folks kind of talked about like the distrust that people have in the vaccine and the distrust people have in the reopening plans. And I think that in thinking about that and grappling with that, people also have to recognize and think about and grapple with, 400 years of systemic racism in America. And that's where people's distrust is coming from, and I know the CDC itself actually did a report on school reopening, and I think about 65% of white identifying parents said that they should reopen in this coming fall in 2021, while less than half of Black parents said the same thing. And I think that these are things that when we think about, where's this trust coming from, that same distrust is coming from the fact that our schools have not been integrated meaningfully ever in, and so I really hope that this moment will, um, people will take this opportunity to not just respond to COVID and find ways to open our schools and get children and students and teachers back into the classroom in a way that where they feel safe, but also take this moment to kind of uh, recognize where all of these inequities are coming from, and in fixing inequities in COVID, also fixing the inequities that were here before COVID.
Okay. I just want to add that, and thank you, Emma, for grounding us in this, is I want to see New York City as a place where we can not just reimagine schools, but also reimagine what the city actually does. How are we going to not go back to normal, but to go to something new and more powerful? Allow for New York City to establish the richness and culture and understanding, and all the wonderful things that come out of the city. But we can't do that without actually thoroughly addressing that which continues to hold us back, that which continues to, I guess, impale all the wishes that we have for this great city. Too often, a lot of the folks who have these critiques are coming from a source of hope and a source of love and wanting to, see better for the city. But unfortunately, too much of the conversation is split up into folks who want to reopen schools and folks who don't, versus folks who are like, what is the city gonna actually do for me at this moment in time? And that insecurity comes from systemic racism, sexism, homophobia, transphobia, classism, all these different elements that do not get addressed systemically or structurally. And so I'm going to insist on all my colleagues, Black, white, etc., especially my white presenting folks, to be a lot more conscientious about how this is going to look like for folks who you might not otherwise live next to, knowing that New York City is so segregated that you may not see so many of us unless they're working at your restaurant, they're working at your supermarket, they're working at your hospital. As soon as we are able to have a better conversation about what these things look like, then we'll be able to have a better unifying message for so many of us who, yes, both we want to go to school and we want all of our kids to be able to go to school. And then when they go to school, we want them to have the best experience possible, because all schools can be much, much better, especially for the folks who need the school to be better. And we need all these schools to be great the first time around.
So I think listening to the conversation tonight, one thing that I would advise is, I think it would be really useful to think about a multiracial cross-community coalition around these questions. I think that could have two benefits. One, I think it would be more effective in moving the city towards the goal of reopening, and it would also begin to work on some of these other deeper issues that we've been talking about. And I think we would want the union to be part of that coalition. And I think, they have a very long and deep goal of having ties to parent leaders across the city. And I think that if there really is a multiracial coalition that represents the city, sort of helping the city think about how to move quickly to reopening, that includes the UFT, I think that would be powerful in terms of moving this forward.
I'm just gonna really echo and agree with what Emma, Jose, and Shael have said already about these issues of equity and what we need to do about that. But in the interest of time, there's really one other point I want to leave you thinking about, because I do think this is going to have real implications for what school reopening looks like, what is expected of teachers and other educators, and that is around vaccines. And will there be vaccination requirements for students, for teachers? Will those requirements come while the vaccines are still under emergency use authorization, or would that follow a full FDA approval? I think more likely the latter. But I do think this is something, Brad, you and other leaders should be speaking with, not just public health officials, but legal counsel to figure out what is appropriate here. One example of what this could look like, because you're going to have some people who will not want to be vaccinated, at least not for the foreseeable future. In the healthcare setting, we have vaccination requirements, and so I cannot go to work if I have not received certain vaccines. One of which is the flu shot. You have a lot of people who don't want to get flu shots, and there is the option as a healthcare worker to opt out of the flu shot if you agree to wear a mask for all of flu season. And I can tell you, most people end up getting the flu shot because they don't want to have to wear the mask. Masks are probably in our future, at least for a while yet, period. But I think this is something that we do need to be thinking about proactively. What are we going to require of students? What are we going to require of our educators with respect to vaccination? Are there opt-outs? And what are the other layers of protection that we know work and that would be reasonable substitutes?
All right, so first I want to say a huge thank you because, we asked these panelists to stick with us from 7 to 8 and now it's 20 minutes to 9. And I feel really grateful to all of you for doing that. I'm going to give a special shout out also to Amy Sandeman for being a guest panelist on a minute's notice. I also want to express a lot of hope. This really hard things to do, but listening to the four of you actually makes me really believe we are actually capable of what we need to do now, and what we got to do for the summer and for the fall. And we're actually capable for using this as a moment to make some pretty necessary and profound longer term changes too. I'll say on that front that, we'll see what happens and what lands in Albany. But it looks like there's a decent chance that Albany, after many, many years of cheating our schools about the money that they're due for the Campaign for Fiscal Equity, is going to show up with some resources. And if we have the resources from the American Rescue Plan to reopen safely, and we have the resources from Albany for the Campaign for Fiscal Equity, wow, this is a moment to take advantage of getting reopened in ways that are safe and supportive, but also move toward a vision of seeing our kids developmentally the way that Shael kicked off and implementing the kind of racially just perspective that Emma and José brought so powerfully. So that is, it's hard and it's hard to feel hopeful, but I just want to be grateful to the four of you for giving me a sense of we're capable of something a lot more powerful than I think we feel in these Zoom boxes, or at least than I feel in these Zoom boxes sometimes. So that's worth a lot. Let me commit to a few things on my, from my end as well, just because a lot of you came here from that perspective. So what we're in right now, the timeline, there's a lot of overlapping timelines because the end of the school year, the budget process, and the elections are all within a week of each other. Earlier on, my mom, that guidance counselor I mentioned, she was here. I don't see her anymore. They're coming here because they got a college graduation, a high school graduation, and my election all within 4 days of each other and 1 week in June. So, and we didn't get to outdoor schools, but I just want to let you know I'm fighting tooth and nail to make sure that the DOE and the city set up a whole bunch of big tents so everybody that's due a high school graduation could have a really dynamite outdoor graduation in a giant tent in some of our parks. And let's learn from outdoor education and build that into forward-going education. There's a lot more to do there. But on the politics, so we clearly have a lot of work to do to keep building pressure for a few things. For the suspension of the 2-case rule and its replacement with an adequate test and trace system now, for planning now for what it's going to take to be open in the fall. And that means clarity to principal about their school budgets. And it means establishing a space for the kind of process that Shael described. And I want to work with you guys to keep putting the pressure. I do think, as much as we might wish we could direct it somewhere other than Bill de Blasio and our new chancellor, they are the decision makers we have through June 22nd. And we've got to keep putting pressure there. There's other things people can do. I know there's people talking about some other kinds of pressure that can be built. Let's keep talking about it. In that place, I'm going to be an ally as well. Organizing has taken place on the ground. And I think if it could be infused by what we heard tonight, there's a lot of room to make it stronger. And then I guess on this, point that Shael made about sort of more multiracial, multi-stakeholder coalition, I think what I can offer is this. Like, I'm limited in what I could do as a council member between now and the end of the year. If I win my election on June 22nd, what I will promise you is that on June 23rd, well, I guess we won't know who wins for a few days longer than that because the vote counting with ranked choice is going to take a little longer. I will be thrilled to use the position that I have to try to convene that process. We'll see who the new mayor is. We'll see what they start to do. But I would be glad to use the implicit office of the comptroller. Look, I won't be a public school parent anymore because my youngest is graduating in June. And I won't have the endorsement of the UFT, but I'm the son of a public school teacher and I couldn't love public school teachers more. And I'm gonna be showing up for them. And I'm a District 15 lifelong parent, but I feel so lucky to be in partnership and solidarity and organizing with folks like Emma and the young people of Integrate NYC and Teens Take Charge. We can build something that demands that we get our schools open in the fall the way that's been described here, and in a way that builds collectively toward that vision that I think all of our panelists have described and answered in that first question. So that's your commitment from me. Obviously, I'd love to have your support to get there. This was a campaign event that didn't involve a lot of campaigning, but if this kind of panel, if that kind of reopening, if that kind of commitment is what you want, you're going to hear from our organizers, both about how to work together toward the school reopening we discussed, and about helping me win so I could convene that panel afterwards. And I just feel really grateful. This was a dynamite panel. I want to thank the folks who organized it. So Steph Silkowski especially, and Naomi, who set this up and fought the trolls. Thank you to our organizers, Amba and Noah and Lily, who brought a lot of you here. Thanks to everybody who came. And just one more time, the biggest of thank yous to Emma Rehac, José, Vilson, Shael, Polakow-Suransky, and Dr. Celine Gounder for grounding us in a really dynamite conversation tonight.
Thanks, Brad.
Yes.
Thank you.
Thank you all.